Today's episode of the StallSide podcast was brought to you by Rood and Riddle Veterinary Pharmacy.
How's it going today, Bart?
It's a good day. How are you?
Hey, good, thanks. Okay, so very interesting guest on the show today.
Yes, Sarah Myer Thompson from Biologics is here with us, talking about where we get our plasma. And I understand that there's lots of different suppliers, and we just went to one. We're trying to figure out, I want to talk to her about processes, how we get this stuff, why it's so blasted expensive. We know what the good it does, but where's it come from?
Yeah, it's a nice little bag of gold, isn't it? Right, and it's gold for a reason. And I mean, there's cost and there's value. And I really want to get an insight into what goes into creating this product, because I'm sure not every horse that walks off the street can be a donor.
Right. Yeah. No, there's a lot more that goes into it, I think, than we realize. So I want to get into the nuts and bolts of it with her and understand that better.
Yeah, absolutely. And I look on it because I use a lot in the clinic. These sick foals come in, and one of the most impactful thing I can do is actually give this foal's plasma to get its immune system to where it needs to fight off whatever infection it has. So for me, yes, it's a cost, but I look at the value, and I consider this to be one of the most impactful things we can do.
Absolutely. Gives them a great start to life. So I'm excited to talk to her.
I should have had some plasma when I was born. Maybe I wouldn't be here on StallSide now trying to make a living. So coming up on StallSide this week, Sarah Myer Thompson from Biologics is going to talk about the magic that is equine plasma.
Some living you're making off of StallSide.
I'm not getting fat on it, Bart. Getting fat on other things. Sarah Myer Thompson, welcome to StallSide.
Thank you so much. I'm very pleased to be here. Thanks for having me.
Yeah, we're looking forward to the conversation.
So, Sarah, tell us a bit about yourself.
So, my name's Sarah. I am the CEO of Biologics, located outside of Ames, Iowa. It's my family company. My parents, Mark and Betsy Myer, started the company in 1999, back when I was in high school. And I really just fell in love with it. I enjoyed the business. I enjoyed the science. And I've been here kind of ever since, with, school dotting my schedule in between. But I've really grown up in the plasma world. Before Mark started MG, he worked for a company that specialized in porcine plasma. And so when it would be, take your daughter to work day, I would go in and learn all about plasma and antibodies and T cells and B cells and FC regions. And I would walk away and think, oh, my dad is really smart in like one area, right? And turns out now I'm the one in the hot seat, realizing just how much there is to know about the immune system and about antibodies. But really loving it. We really believe in the magical intricacy that happens when you stimulate the immune system, when you collect plasma, when you give that as a passive antibody over to another, to a foal in this case, and the magic that happens and what the immune system does. So we believe in antibodies, and we really love what we do.
And your dad is a smart guy, by the way.
Yeah, seriously. So swapping blood products around is sort of an older science. Tell us about how that evolved and how your company has actually progressed with that and advanced with it.
Yeah, I'm happy to. So I actually have a couple pictures, and I didn't go as far back as maybe I could have, but antibodies and antitoxins became really popular in the late 1890s. So it's a very old science. It's been around for over 100 years. But when you look at the pictures, you're seeing blood collected in open vessels directly from the horses. And so there's, dust and horsehair and everything else coming into that open vessel. But they understood the rudimentary science of how there's this, portion of the blood and an antitoxin that's going to help the patient and benefit them when they're sick. And so in the 1890s, it started with diphtheria antitoxin. At least that's the first one that I know of. So I have an illustration showing that, followed by the NIH website. I was able to find a picture of really early antitoxin collection. And a lot of times when people say, oh yeah, I grew up and my veterinarian made plasma, this is what they're thinking of. They're thinking of a catheter going into an open vessel that's essentially pretty dirty. And that leads to adverse events. It leads to a lot of problems. So 130 years ago, this was cutting edge, and it really did save a lot of lives. And especially with diphtheria antitoxin, there were, went horses into humans. The problem was that A, it was unregulated, and B, the horses, they didn't have the means to check for disease like we do now. And so one of the horses named Jim was sick with tetanus. No one knew it. And about a dozen children died. And so that's really when the FDA became about, was about early 1900s. And then shortly after that, hog cholera was happening, in the early 1900s in the US. So there were serum companies all over in like specific regions. And there was the same problem because it was unregulated. There were a lot of health issues. And so hogs were actually getting sicker, and they were trying to prevent it. And so that's when the USDA was established, and the Virus Serum Toxin Act of 1913 was introduced so that the general public would be safe when people like me come and say, hey, I have a blood product and it's super duper. Now there's checks and balances to make sure that we really are what we say we are.
That's fascinating history and insight to how things came about. I mean, it really was Wild West, wasn't it? There's no regulation. I mean, of course, we understand a lot more about disease now than we used to, but you look at what went on and just think, how did anybody survive with that degree of lack of sterility, I suppose is a way to describe it.
Yeah, and Peter and I probably, at least I do, would take it a little bit for granted because we go to the freezer and pull it out and thaw it, and it's a nice, clear product, and we run it in without thinking too much about where it came from and how it got there. So anyway, why don't you run us through that? Where are we at now versus where we used to be?
Sure. So now any reputable plasma manufacturer is likely going to use a human grade product or a human grade machine, a plasmapheresis machine to collect. And we're the same. We use human plasma machines that we trick into thinking we have a 1,500-pound human. And so we go through the collection process. We have a facility that we built about 15 years ago, specifically designed to have horses on site, collect the plasma, manufacture it and process it in the labs, and then we test it on site as well. And so there's many steps that are happening behind the scenes to your plasma before you actually get it in your hands. And it starts with, before we even can bring the horses onto our land, they have to pass a variety of tests to be able to be considered, as a donor. Then after we do these tests, there's about 7 blood typing tests or blood disease tests. And then they have to pass actual blood. Well, yeah, I guess it's all blood typing and disease based tests. So once that is determined that they're equine parvovirus free, that they, are EIA free, that they don't have AACA-QA antibodies, all those things that could create a problem on your end, then they're allowed to be quarantined and to enter my herd. And then that's when we start doing testing and grooming their immune system to be hyperimmunized or vaccinated for whatever the product is going to be.
Yeah, I don't think people, end user, realize the steps that go into and all this product and all the quality control that happens, because the conversation we have is that, well, why does this stuff cost so much? But when you listen to you talking about all the steps that have to go into actually getting a product of that quality that we feel confident using, this is extremely expensive. You can't take any horse off the street. There's a huge amount of screening that goes on. These horses cost a lot to maintain. The equipment that you're using sounds very expensive, and I haven't met any 1,500-pound humans, but thanks for actually tricking the technology into being able to collect this plasma. So it makes perfect sense to me that this is an investment in a foal's health, and it's extremely important from our end that without plasma, the problems are legion in these foals.
Well, I mean, I would fully agree with you. Starting with where you're at in terms of the expense of getting the horses ready. Typically 1 out of 10 donors that are 10 potential donors that we test will work for us. So we have to go to 10 different backyard ponies to find one that's going to meet the right requirements. That alone is time consuming, and creates a lot of barriers in terms of, there's now only so much plasma that we can make. Technology keeps advancing, which is wonderful. And at the same time, take, for example, Tyler's disease. For decades, no one knew where it came from or what it happened, but we knew that it happened in plasma transfusions. And so there's a warning on the bag. In the past, let's say, 7 years, it was discovered that equine parvovirus contributes to that. So now we have to retest our herd, and the donors change more often than you would expect. In fact, just last week, I got news that one of the donors that we had just bought, his blood changed, and he's now equine parvo positive, and so out he goes. And so, whereas before we were having a more stable herd, that it was hard to get them to come in, equine parvovirus is a new regulatory difficulty that adds a lot of expense to our maintenance, which is why now there's a lot more testing, because we want to make sure that we're not putting you into a position where you could have that risk to your patient. And so there's a lot of these things that are coming up now. The more that we know, the more that we're testing, it's increasing expenses, unfortunately.
So once you've actually got the plasma harvested from the horse, and Bart alluded to this before, we go to the freezer, there's this nice plastic pack in this nice box, very well padded, that we can just take off the shelf and use with confidence. How do you actually get that plasma packaged like that? How do you, like the dynamics of freezing it, how do you do that? Because that looks very complicated.
It is complicated. So again, once you have the plasmapheresis machine, think that you have a 1,500-pound human, you're now able to collect a large volume of plasma. So once we collect that, we send it off to our labs to test for IgG, total protein, albumin, the specific disease type that he was vaccinated for. So let's take rhodococcus, for example. We tested his rhodococcus equi antibody level to see if he qualifies for that product type. And once we have once he's passed that set of testing, and then he also gets disease tested to make sure that that particular day he was in good health for to be a donor. So once he passes all of that, we take the plasma out of the freezer and we start working with it in our labs in a closed system. And that's a newer technology that we brought to the market that was not well understood 20 years ago. And so we offer blends and we offer different combinations that particular farms may need something specific. But that was really new 20 years ago. That was not understood that you could work with blood products in this way. And so we put it in our labs, we make the product that we need in the end, and then it goes through a series of freezing steps. It has to have a quick quick freeze, so that all of the anticoagulant and the fibrinogen and everything that's in there freezes homogeneously, if you will. Then we keep it kind of in a quarantine shelf, because then it goes through another batch of testing. So by the time you get it into your hands, it's already gone through 3 rounds of different sets of testing to make sure that when we were working with it, we didn't introduce anything that we shouldn't have, right? And so once it clears those stages, then it gets sent to your clinics, and you guys have to thaw it. So we specifically put it in.
That's really hard to do, by the way.
Well, we put it in a flat bag so that it would be easier, because plasma is not, any blood product, it's not supposed to be 115 degrees or 120 degrees, which is what we think of, hot water when we thaw something. So the faster that you can get it thawed, the better the product's going to be, the less opportunity you have to denature something or to create a problem or to put the plasma in a situation where it's not going to respond nicely. And so that was another change that that's very different from what our competitors do, because we want plasma to be in its most natural form as often as possible. And so putting it into these hot water tanks and doing a 45-minute thaw is not going to be kind to the plasma. And so we kind of have a slogan around here where we say, if you're nice to the plasma, it'll be nice to you. And so we want to do these quick thaws to keep it in a natural state so that Mother Nature can give the foal all of the goodness that she's put into plasma itself.
Yeah, that's a good point about the thawing, because having it flat, it does thaw very quickly and very uniformly when you, as you say, when you look after it. You touched on Rhodococcus equi before, and that's something that there's been a little bit of a change recently in that, we used to do things a certain way with a certain amount of plasma, and there's some information that's come out that perhaps we needed to adjust what we were doing. Could you comment on that for us?
Yeah, I'd be happy to. Well, Dr. Ron Martins from Texas A&M did the initial plasma studies in the 80s and determined that 1 liter at birth was I'm going to use the words beneficial. I believe it was statistically beneficial in helping prevent REQI in miniature foals. And so that 1 liter kind of stuck, and a lot of the research 20 years later, I think 25 years by the time we did our Rhodococcus research, was done with only 1 liter of plasma, but we didn't use miniature foals. We had, 100-pound foals. So we did 1 liter into 100 pounds, and our published research with Dr. Kasten and Dr. Cohen showed that we statistically significantly reduced radiographic lung lesions at day 28. It was a really heavy experimental challenge. So that's really where that 1 liter came into mind. Additional research has been occurring over the years, and Dr. Sanz has done some great research comparing different manufacturers, but it's really kind of ended up with this perspective of going back to following Dr. Martins's original, which is per the volume per pound, matching that. And so that puts a 100-pound foal getting 2 liters now. And there's 2 different papers that I know of, one with Suzanne Kahn and Dr. Cohen, where they did a, I believe it was more of a retroactive, but maybe that's my word, study of looking at subclinical. When you use 2 liters, how does it look on subclinical REQI? And they showed evidence that antibodies in a higher volume can be more beneficial. Dr. Patricia Flores-Allschwede, who you guys know, continued some of that research looking at clinical protection, showing that 2 liters appears to be a benefit over 1 liter. In fact, I think the exact words that they used in that paper in the conclusion is that it is probably superior. 2 liters are probably superior to 1 liter in reducing the incidence of REQI. I believe that that's, if you look at a release titer for a Rhodococcus antibody should be around 1 to 10,000 antibodies. So if you're giving 1 to 10,000 antibodies, and an antibody has a half-life of 3 weeks. So at 3 weeks old, they have 1 to 5,000. 3 weeks after that, they're going to have 1 to 2,500. So it's reducing over time because the body, a foal's body, doesn't just accept the plasma antibodies as its own. It's not an active immunity, it's a passive immunity. So my plasma joins the foals passively and says, we're going to protect you for this time, but then we're going to go down. They're going to decrease and have this half-life. So if you start with 1 liter at 1 to 10,000, you're at 5,000, 2,500, 1,250. If you start with 2 liters, well, now the foal has 1 to 20,000 antibody titer, right? And so at 3 weeks, it's 10,000. 3 weeks after that, it's 5,000. You're just giving them this greater start at the beginning. And we believe that's why we're seeing the research head in this direction.
Yeah, it was a bit of an eye-opener, but in the same way, almost sort of seemed obvious when this was first discussed, in that once you sort of found out that there were relatively small foals, which the 1 liter of plasma was being used on, it comes down to a concentration, right? And so if you've got a bigger foal, you need more plasma. And knowing that they're infected so early in life, giving the 2 liters really does boost up that period of protection a lot longer than it was before. And giving the 1 liter at birth and the 1 liter at 30 days, I mean, that doesn't sort of seem to make sense when you actually look at the having the higher concentration when they're actually born. So you're better off to do the 2 liters early on. And that, has actually really helped some people clinically on their farms. And they say I have less of a problem since I've started doing that. But again, rotococcus is such a wily beast. There's so many factors that go into it. But for some people, this has really helped. And it helps to have this conversation with the client base, because they're saying, I'm spending all this money up front. What's the evidence? Well, it seems to be that there is good evidence that this is a more rational way to approach it when you look at the signs.
Yeah, we had Dr. Cole on earlier in the year, and we talked about the same thing, and he brought up that whole first study with the miniature foals, and it makes a lot of sense that they had a lot more antibodies per pound than we're putting into our 150-pound thoroughbred foals.
Yeah, I'm really intrigued, like generating this hyperimmune plasma. And how is that, how do you actually get that done with the donors? I mean, what's that process? Because, I mean, that sort of like fascinates me, that you can pick these diseases. Like some people want, I want something against like Clostridial diarrhea. Some people want rotavirus. We have Rhodococcus equi. Do the horses all respond uniformly to the challenges that they're given? Are some better than others? Is there any way to sort those horses out?
And in answering that question, I think most of us think of failure of passive transfer and Rhodococcus are the 2 reasons that you use.
Yeah.
But there's a lot broader region. So if you could talk about some of your products or some of the products that are available.
Yeah, I'd be happy to. Let me tell you, I have dreams about just, having the donors line up order of efficacy to what they're going to respond best to. In reality, it's hit or miss. And some horses will respond really well to Rhodococcus. And so great, he's now a Rhodococcus donor. Other horses, you try him on Salmonella, didn't hit. You try him on C. perf, didn't hit. Now Rhodococcus, okay, that's good. We have to really kind of figure out what that looks like. That adds to the expense, because some donors will meet 100% of the criteria and then they don't have a great immune system. And I mean, it is just a punch in the gut. So what we do is we have a unique approach. Instead of saying, well, all of my donors are going to be hyperimmunized for everything that I could hyperimmunize them for, we took a different approach to it and said, one horse's immune system is going to focus on one type of antigen. And so our Rhodococcus donors only focus on Rhodococcus, and the Salmonella donors only focus on Salmonella, C. diff, C. perf, Strep equi. And then that's why when we go into our labs, we specifically mix to whatever the farm wants. And so the belief there is that when the immune system has to respond to a lot of things, like when you and I go and we get a shot for as kids, we would have gotten an MMR vaccine, right? So they combined them together. But for measles, we need a protective titer of, say, 1 to 32, or maybe 1 to 64, if we really responded well. Well, hyperimmunized donor, before we arrived on the scene, would have been at 100 and 256. So gone 64, 128, 256. Wow. He has 256 to compete against the one antigen. This is going to be a really great response. And that was hyperimmunized. And so they did that, and they did that with any of the antigens that you're looking at. We came in and we said, well, the immune system, this is Mark Myer, the immune system can't do that. It can't focus that well. What if we gave it just one and we tickled the immune system in a way to respond? And so for Rhodococcus, my minimum release titer is 1 to 10,000. And we're doing research on other types, the research in C. diff. I have a couple donors that are at 1 to 104,000 consistently. So we really make sure that their immune systems can respond to these unique things, so that now when you want to use 1,000 mils of Rhodococcus, or let's say you want to do 2,000 mils of Rhodococcus, but you're worried about diarrhea on your farm, but you don't know what diarrhea it is. Okay, well, let's make a combination, and I'm going to take a little bit of each of these donors and combine that for you and make you a custom product, because now you don't need a full liter to help you with your need. And if you're looking at, say a diarrhea problem, and you have a liter of Salmonella and a liter of C. perf and a liter of C. diff, and you also wanted to give 2 liters of Rhodococcus because you have a diarrhea problem, well, now you're giving 5 liters to a full. We all know that that's not going to happen. So our science took a different approach to say, let's utilize our donors' immune system as best we can, so that the full doesn't have a volume overload problem and can have, a plasma that's specific to what they're facing on the farm. And that's when we come in with blended products, which was new. 20 years ago. There still is a lot of misinformation and misunderstanding around it, but the reality is that while I can't guarantee the effect that it'll have on your farm, because I've never done this particular research on this farm, right? We're taking the knowledge that we have and saying, how do we best benefit your needs? And then you tell me how it worked. You know, Dr. Barber, oh, you use this, but you still had this problem. Well, let's change it up. Let's address it for next year. Let's do something that's different, because we have the flexibility to do that back in our labs.
I think that gives us a much better appreciation of how things are actually done, because to just actually have horses concentrate on responding to one antigen and respond well, and then mix that plasma with another horse that responded to one antigen and responded well, makes much more sense than a scattershot approach, sort of saying one horse is going to try to be all things to all foals. Because you've explained that doesn't make sense.
Yep, that makes sense.
And so that does clear up the blended thing, because, you know, everybody asks, well, why is this plasma made from multiple horses? Why is it not from one horse? And this is actually, as you say, you're targeting a titer. You're not targeting a comprehensive response from one horse, which, you know, they can't do it all.
Absolutely. In fact, if I had a horse that could do it all, it would be, you know, $1,000 a liter, because it would be so unique and so difficult. So
yeah, and that horse would be called Bart, because he can do everything.
Do it all.
He could do it all.
Versatile.
You know what?
Five gated plasma donor.
So
the next two donors I have are going to be named after you two.
all right, I like it.
Yeah.
I'm the big, tall, lanky one. The little short pony can be Peter.
Yeah, that's right. He won't stay in the herd very long, because he won't be good at anything. I can see that happening.
I am curious if you could answer some questions for me about the horses themselves, and is there a breed predilection that's better? How often can the horses donate? You know, and how many horses do you have on site?
yeah, so we have a couple hundred horses on site. You know, somebody asked me the other day, oh, so, you know, you love horses. Do you have a horse? No, I have 200 of them at work. That is more than enough horses for me. And, you know, horses come with their own set of problems. So we collect plasma depending on the donor. And so that's why the testing is so important, because depending on the quality of the plasma depends on how often they can donate. Some horses can donate, you know, every 14 days. They have really high quality titers and their IgGs are good. And that would be, you know, a great donor for me. Other donors can only donate once a month. And then we customize each next donation based on how they performed on the current donation. So it's all becomes very, very customized depending on the horses. And so that goes back to, it's not, you know, as simple as saying, oh, well, any horse is going to be a great donor. No, they're not all great donors. And so what do I, as a manufacturer, what can I do to help make him a great donor so that every time he donates, it's really high quality? So that's a little bit unique. And you asked me another thing that I can't remember right now, but
is any breed predilections?
Breed.
Any of them better? Yep.
Yeah, so we are located in Iowa that has rather harsh winters. So we have found that sturdier breeds do better for us. And of course, draft horses have so much blood and they're just these gentle giants. And so my desire is always to have a nice, strong draft horse. They do really well and they're so sweet to work with. But with these regulatory changes and with learning more about, you know, what's specifically needed, it cuts out a lot of the opportunity to have, you know, your favorite type of horse. And so we have a lot of quarters that meet the blood requirements. And so we collect from quarter horses. We also do quarter draft crosses. Thoroughbreds don't so much like the cold up here. So they have not been great donors for us. But that's really kind of the three that we stick to.
Gotcha.
Well, this has been a fascinating talk. You've certainly illuminated the complexity of what you do, which was way more involved than I think anybody here really realized.
Yeah, absolutely. And it's just getting a back inside look into the facilities and what you're doing is fascinating. How you're doing it and getting it done. Because like I said, to begin with, you we get this nice bag, and it's clear, good plasma, and we have a lot of faith in it, but it's good to know what goes on before it gets to us and all the testing that goes on. And it's also important to know that you're taking really good care of the horses. That's important to us as well, that those horses are being well cared for on your end.
Yeah. And again, we talked about the cost of doing this, but I mean, you've made a strong argument for the value proposition in what you're doing. This is a very complicated procedure, stringently regulated. The standards are high. And let's face it, these horses that you have in your herd, they're sort of all unicorns because they meet all of these health requirements, and then they are expected to have this really good titer to a specific antigen so they can go out. And I don't know how you do it all on 200 horses. I really don't.
Well,
thank you. We've gotten very efficient. And that's really important to us because we realize that with all of this testing, with all of this background, with what it takes to get a donor ready to donate, the expenses could be incredibly high. And so we understand. In fact, I was listening to one of your podcasts, I don't know, maybe a year or so ago, and the individual was talking about the importance of plasma for foals and how it's this glorious, magical, golden, expensive, product. And I laughed and was like, it is all of those things. It's to the extent that we can keep the cost as reasonable as possible, that is really of high priority to us. We want to serve the equine industry well, and the equine industry has been so wonderful to us. And so we want to come in as good partners. And at the same time, I would like to continue providing plasma over the long haul. And you have to charge enough to cover your costs. And so it is expensive. I think it's really important for people who have questions to call in and talk to us, or you can ask for me. We want to make sure that people understand what you're getting. And if you're not getting what you think you're getting, let's talk about it. Which actually leads me, we didn't mention this at all, but adverse events happen with plasma. We can do all this testing and do everything in our power to prevent it, and it still occurs. And so can I talk about that? Is that okay?
Yeah, please do. Actually, that was a question that I had that I failed to bring up, but yeah, go ahead.
Yeah. So first of all, I just want to encourage veterinarians, whether it's my product or somebody else's product, to always record your serial numbers, or, if the veterinarian isn't, if whoever's doing that at the farm, if the farm manager, make sure you're recording your serial numbers, because we can donate and we're required by law, we can track, and we're required by law to track down to, the donor, what the donor's health was that day, down to when the donor was acquired. We can get very, very specific details. And through some adverse events, we have learned things about our own products that we didn't know previously. And so that is one of the things that if you have an adverse event, we want you to call us to tell us what's going on. Those get reported into the government so that they're tracking and they're aware of the product quality and how it's performing out in the industry. And then it also gives us as a manufacturer an opportunity to call everyone else who received the cereal, put a hold on it. We go and we retest, and we make sure that all of our tests in-house didn't have a hiccup or, something that was unexpected. And that gives us an opportunity to see, is it a blood type incompatibility? It's rare, but it happens. Is it, an endotoxin issue or a sterility concern? Also rare, but, we're not perfect and manufacturers could make mistakes. And so that's why we put everything back on retest to make sure that by the time it comes to, you, or I know that I just had a reaction, with somebody else, let's put a hold on the cereal, let's retest. Okay, all the testing came back clear. Now you as the veterinarian can make the decision. I have all the information on this. Is this how we want to proceed or not? And it doesn't happen a lot. I don't make those phone calls, often, but I do make them. And I think it's really important as people get comfortable with plasma, which is wonderful. We still need to keep in mind that you're taking a product of blood origin from one animal and we're putting it into another animal. And things can happen that we don't expect because we're still learning about the immune system in new ways. So that's my little soapbox on please have your serial numbers. Please be in contact with your manufacturer. We want to hear from you and we want to make sure that the products we're supplying are high quality and safe.
No, that's good information. The reactions we have now are much lower than what we had 20 years ago, right?
Yeah, and I think that's part of eliminating all the things that you can eliminate. You're putting a foreign protein into an animal.
Yeah.
You know, what could be potentially more immunogenic than that?
Well, and it seems like the newborn foals handle it a lot better than the older, like
Yeah.
the 30-day-old foals. We had some problems with them. Then the other thing, Peter, is, we know that if a foal was NI positive and they got a milk replacer product, that makes them more likely to have a reaction too. Why is that? Do you know?
Yeah, I think it's the bovine sort of casein source that sort of they're not very happy about when it comes to getting plasma.
Can I speak to that?
Yeah, please do.
So that was something that we found out kind of frustratingly because when we were getting calls about NI foals having reactions, it was down to one donor. And fortunately, the people who were calling us had the serial numbers and we were like, why is this donor creating this problem? He's my highest titer donor on this particular product. And when we looked into it, the vaccines that we were using use fetal bovine serum as a media to grow up the rhodococcus, right? Or whatever he was on. And so as we were grooming his immune system to have a really high titer against this antigen, we were accidentally creating this high titer against bovine. So now you have this really great plasma product and you have foals with open gut who are drinking milk replacer and getting that bovine into their system that they're uptaking. So now you have this bovine protein and then my anti-bovine plasma that's going to create this problem in the foal. And so it's one of those things that we really, when we get phone calls that say, oh, he's an orphan foal, we're like, have you given milk replacer? What time did you give milk replacer? Trying to help you figure out whether or not you're out of the woods, so to speak, in terms of administering plasma, because there can be that type of reaction.
Yeah, and let's face it, the horse's immune system was just doing what it was told.
Yeah.
Absolutely. Yeah.
Sarah, this has been a fascinating talk. Thanks for your forthright answer and your comprehensive approach to your product.
Yeah.
Thank you so much.
You might be as smart as your dad too.
Stop.
Yeah.
Not yet. I'm still working towards that.
Yeah. Well, and again, thanks again for your time. This is really, it's really explained the value of this product to our audience, and we're really grateful for that.
Yeah.
Well, thank you.
We're grateful for the plasma too.
Yeah, seriously.
We take it for granted and we use it, and it's fabulous stuff. We really appreciate it.
Yeah, it's just absolutely it's just a mainstay in the clinic. I mean, these foals come in and they just need it, and without it, we're just in so much trouble. So I can't thank you and 200 woolly draft crosses enough.
We're happy to be here for you.
That's great. And that's StallSide for this week. We were with Sarah Myer Thompson from MG Biologics talking about the production of plasma for use in horses. See you next time.
Today's episode of the StallSide podcast was brought to you by Rood and Riddle Veterinary Pharmacy.